So I've been working over the last several days across two large hospitals in central Birmingham. I've also spoken to colleagues in areas of Birmingham that have been hit with these outbreaks that we've been seeing. And I absolutely agree that testing is the right way to monitor for outbreaks. It just might give a slightly skewed picture as we enhance the number of tests in terms of the national number of cases. But in Birmingham right now, across the hospitals I've spoken to, that covers well over 50% of Birmingham's population, we have less than 20 cases currently seriously ill and fewer than 10 cases currently critically ill. Compare that to with where we were a couple of months ago, where we had almost 200 patients ventilated at any one given time. And this is a huge downturn. And we've seen the same in other countries.
Yes, and particularly in Spain, we've got a high level of infection, but the lowest level of people in hospital. So does that lead you to think that actually our judgments about the progression of COVID should be made on the number of cases that are hospitalised rather than the number of people who are testing positive for the virus out in the wider world?
Well, I think we've got to look at both together with the proportion of tests carried out that have been positive. We've got to look at all of the data rather than any one data set in isolation. We've moved from, of course, flattening the curve to protect our healthcare systems to controlling the virus. But what we can't do is to make that move and consider the two entities completely in isolation. Our NHS within the UK right now is filling back up with the normal caseload that we would see at this time of year. We're seeing very few admissions with people with coronavirus. And that's true whether we're in Birmingham, whether we're in Swindon, whether we're in Reading. It is simply the case that although we're testing more and identifying more cases, our hospitals are not yet. And the experience in Spain and France, they've had a couple of weeks ahead of us in terms of an increase in number of cases. Their hospitals are also not yet filling up with sick people.